I was born on January 8th, 1972. I was born at 3:12 a.m. and my sister was born at 3:14 a.m. So we're 2 minutes apart. About 3 days after our birth, Anna had an intestinal blockage, and that's when the doctors suspected that she had cystic fibrosis. In 1972, when my parents were told that we did have cystic fibrosis, they were also told that this is a very severe disease and that we would be lucky if we lived 10 years. The way that cystic fibrosis affects our health is that it is a disease where there is an excess of mucus in the lungs and in the intestines. So we were frequently coughing, we were frequently short of breath, and we would have to go into the hospital for IV antibiotic treatment for several weeks at a time, several times a year. Every single day, for 2 to 4 times a day, we had to do respiratory treatments. That meant inhaling a medication and then doing chest percussion on our chest and backs and sides to loosen the secretions so that they could be coughed up. At the age of 6, we went into the hospital for 5 weeks straight, and in that hospital stay, we met another child with cystic fibrosis whom we became friends with. A year later, she passed away. So when I was 7, I realized that this illness that we had is rather serious. It wasn't until the late 80s that we heard that transplant was much more successful. But when you have CF and you live with a chronic condition every day of your life, you gain a sense of control. And so our goal was not to get a transplant until we really needed it. And so we fought stubbornly until our late 20s, pretty much, to just live the best life we could with our disease. The decision to get a lung transplant was one of the hardest decisions I've ever had to make. And it came to me when my lung capacity hit about 30%. Slowly but surely, everything around me became consumed by the ability or inability to breathe. I heard about Stanford's lung transplant program through Kaiser. The program was, pretty much world-renowned. Dr. Bruce Wrights was famous around the world with his first heart-lung transplant. So it was a sense of security, confidence, that they knew what they were doing. And I think meeting other patients who'd had transplants through Stanford helped me feel at ease that this was the right place to come. I think there's 2 miracles that happen in hospitals: babies being born and transplantation. I've really grown to appreciate anyone who works in lung transplantation at Stanford, at other hospitals, because lung transplantation is not easy, and it takes incredible spiritual, emotional, physical strength to be a care provider in that area. After the lung transplant at Stanford Hospital, they provide great support. By 10 weeks, I rode a bike for 10 miles. No coughing, no shortness of breath. I felt amazing. By 2 months out, physically it was a night and day change to cystic fibrosis. My journey with lung transplantation was much more of a gradual decline, whereas my twin was relatively stable and then did a crash course. On the eve of my 30th birthday, I had a severe lung bleed, and that led to 2-month-long hospitalizations and pretty much advanced CF overnight. But then things dramatically got worse. For whatever reason, my lungs just decided to stop working. And unfortunately, I very quickly went into respiratory failure. And the chances of getting a transplant were very low because at the time, in 2004, the waiting list was organized for lungs as a first come, first serve. So there had been people on the waiting list for years, and then all of a sudden I'm on it. My sister called my parents when I became so critically ill and said, I think this is the end for Isa. And they came up from Los Angeles, and my mother had a black dress on, and she just was preparing for the end. My mother said, I have been preparing for my death of my daughters all my life, but now I'm not ready. So from the deepest despair, that's when the doctors came in and said, we have lungs for Isa. And all of a sudden their despair was completely lifted. And that's the yin and yang of transplant, that through someone else's death and through almost the death of the recipient, we are brought back to life. Words cannot express how tremendously grateful my family has been. I came home from the hospital 20 days after my transplant. Every day I made sure I did a little bit of exercise. By 3 months, I rode my bike for 10 miles and I went on a 6-mile hike 5.5 months later. So the progression of health was just exponential. Lung transplantation is one of the most risky and shortest survival organ transplants that exists. 50% survive 5 years. I don't know exactly what happened. I was the epitome of health. Someone once called me the prime example of a transplant candidate, and I went into rejection a week after meeting my donor family. When I was diagnosed with chronic rejection, my lung capacity fell from 90+% to about 16% in 8 months. I had, by that point, done all kinds of travel, done all kinds of great things post-transplant, and I felt like, hey, you know, I've reached my goals. It's okay now. I can die now. But my sister is what motivated me. You know, you need to keep living. Live for me. I just had my transplant. I want to play with you more. That, plus the very blessed opportunity to have a second transplant, really gave me the motivation to keep living. And so I was one of the very rare few that are offered a second lung transplant. And I am grateful beyond anything to Stanford Hospital for letting me have a second lung transplant. I try to live my life saying with the motto, I'm okay today. And tomorrow, hopefully I'll say, I'm okay today. There were days when I was a kid, I just prayed for one day of freedom from coughing. I just asked for one day of not coughing, and I've already received 7.5 years.